All right, so Thursdays are the time that we typically will talk to folks from the medical community. Today, Dr. Timothy Chase is here talking about a topic that I admittedly had said it just didn't ring right in my head, urogynecology. So I told Dr. Chase, I said, right out of the gate, let's just explain what this is for maybe folks that are in my position. I've never heard of that.
Okay, well, urogynecology is a subspecialty of urology and gynecology. It deals primarily with women that have problems with pelvic organ prolapse or urinary incontinence.
When you say pelvic organ prolapse, because that just kind of goes, what are we talking about in women? I mean, are folks at home, is this a symptomatic thing that people would know, you know, I've got something going on here?
Right. The symptoms primarily are a heaviness or a fullness in the pelvis.
Okay.
They may have trouble voiding, urinating. They might have urinary incontinence.
Okay.
There's different types of pelvic organ prolapse. It can be cystocele or uterine prolapse or a rectocele.
When we get into topics of this, is there an age group that you typically see this in? We were talking a little bit earlier about Alex Trebek with the pancreatic cancer, and I was reading how this is something that usually is detected with folks in their 70s. With your specialty, is this particular to one age group?
No, it really expands upon a number of different age groups. It can cause symptoms as early as in their 30s up through the 70s and 80s.
And is this an annual exam for women? Is this something that they would come to you on an annual basis that is just part of their routine medical checkup?
Right, we would check it on an annual basis, but if somebody has those symptoms, then they can always call and come in and be evaluated at that time.
And for folks that are diagnosed, what is the procedure there? Is this, you know, medicine, oral medicines? How do we take care of this?
Well, for pelvic organ prolapse, there's a number of different treatment options. We like to start conservatively and then see how that works. If that works well, then just continue there. The conservative treatments are pelvic floor exercises, such as Kegel exercises, or we have a number of very specialized physical therapists here in town that are pelvic physical therapists that can help them. There's a device similar to a diaphragm called the pessary that we could fit them with. And then beyond that, there's been some really good recent advancements in the surgery for pelvic organ prolapse.
And for women at home that may be watching this, if they have, again, this will be where I'm a guy, I don't know the difference in this. If they go to a gynecologist on a regular basis, for you doing urogynecology, is that something that, say, if I'm a gynecologist, I would then recommend them to yourself, or is that something that their own gynecologist can take care of?
Yeah, that's something their own gynecologist can take care of. I've had some special training in more advanced techniques in urogynecology for the treatment of pelvic organ prolapse.